So I am the Community Palliative Care Team Lead, and our team is a small team made up of 3 nurses. We're currently recruiting a 4th, social workers, an occupational therapist, and Keenan as our pastoral care coordinator. We visit people all across Mount Alexander who have a life-limiting illness. Some people we visit maybe for the last few years of their life. Some people we might get a later referral and we might only know them for their final weeks and days. To access palliative care in Mount Alexander, you can call us up and refer yourself. You can ask your GP to send a referral, and quite often we get referrals from people's oncologists, respiratory specialists, cardiologists, etc. A lot of our clients do have cancer, and there's been a long association between palliative care and oncology. So I think we're more likely to get referrals for those people with cancer. But we're really keen to also be looking after all the other people with chronic diseases that will limit their life. What was the last bit you asked me, Keenan?
Well, that's pretty good what you've done there. Perhaps I'll actually just ask you a follow-up question to that, which is, given all of your experience in palliative care, what do you actually wish people knew more about? What would be really useful for people to know?
I guess I wish that people understood that palliative care is care that kind of meets you where you're at and will actually listen to what you want. Often people have been through a health journey where they're getting recommended treatments and they might be saying yes or no along the way. But when we're involved, we really just want to optimise your quality of life as defined by you. So when we go and meet a client, what one person wants can be really different to what somebody else wants. But we always find a way that we can contribute to that person's life and maybe make something a little bit easier for them. We have clients who are completely against Western medicine. We have clients who want every last treatment till the very end. And both of those, ends of the spectrum, we can meet people where they are. The other thing is to know about palliative care is that it's not just support of the client, it's also support of their carer or their family, their loved ones. Because when we come in as a palliative care team, we're only there for a tiny fraction of a person's experience, and it's really their family, their neighbours, their community that are doing the hard yakka, supporting and looking after them. So we try and support those carers and take a little bit of their load off where we can, or just encourage them to fill their cup where they can as well. So we're happy to hear from people in the community who are carers. Even if the person they're supporting might not be ready yet, you can reach out and we can point you in the right direction to get some support.